Welcome back to the Deep Dive. Today, we are laying some really important groundwork, the essential foundational knowledge before we even look at specific psychiatric disorders.
That's right.
Because to understand mental illness and mental wellness too, we absolutely have to tackle the one thing that seems to underpin all of it: stress. And we're not just talking about, feeling busy or overwhelmed. We're really diving into the core biological and psychological mechanisms, the things that dictate health and recovery.
Yeah, that's the critical starting point, isn't it? If you look at how the National Institute of Mental Health defines it, stress is pretty simply the brain's response to any demand. It's universal. Everyone experiences it. But crucially, the degree of stress we experience is central to understanding both how psychiatric disorders might develop and also how existing symptoms can get exacerbated, worsened.
So our mission today, using our source material, is to really unpack this response. We're aiming to cover, three main areas?
I think so. First, the foundational science and physiology we'll get into, Cannon and Selye.
Okay.
Second, those personal filters and factors that kind of mediate how stress actually affects us individually.
The buffers and intensifiers.
Exactly. And finally, the practical side, the hands-on therapeutic management and intervention techniques used in clinical practice.
Got it. Where should we start? Maybe with something that challenges a common belief.
Yeah, let's jump right into, a painful truth from the research. Culturally, we have this saying, right? What doesn't kill you makes you stronger.
Oh yeah, you hear that all the time.
Yeah.
But unfortunately, it doesn't really align with the data on resilience, especially when we're talking serious trauma.
It really doesn't hold true, particularly for the development of later psychiatric problems. The source material is quite clear. Early exposure to very stressful events actually seems to sensitize people to stress later in life.
And this is where the term ACEs comes in.
Precisely. Adverse childhood experiences, or ACEs.
And these aren't minor things. They're defined specifically as severe childhood trauma. We're talking psychological, physical, or sexual abuse, witnessing violence against a parent, or living with significant household dysfunction like substance abuse, mental illness, or even parental incarceration. Heavy stuff.
Very heavy. And when you look at the prevalence, the data is just stark. That large Selye study, it found that over half of the respondents reported at least one ACE.
Over half.
Wow.
Yeah. And
maybe even more concerning, about 1/4 reported 2 or more.
And does the number of ACEs change the risk profile down the line?
Dramatically. The data showed a direct, dose-dependent relationship.
Yeah.
If someone reported 4 or more ACEs, they had a 4 to 12-fold increase in adult risks for conditions like alcohol use disorder, major depressive disorder, and suicide attempts. That early stress history fundamentally changes the baseline for that patient.
It really drives home why managing stress is critical across all types of nursing care then, not just in psychiatric settings.
Exactly right. Think about it. If you have a patient recovering from, say, major surgery, a purely physical event.
Right.
But at the same time, they're dealing with a huge psychological stressor, maybe a family crisis or job loss. Their body's ability to actually allocate resources toward physical healing is hampered.
Because the stress response systems are just overloaded.
They're overloaded, so nurses really need to intervene to try and reduce that overall load just to promote successful coping and healing, whatever the setting.
Okay, so if that early stress sets a different baseline, let's go back to the basics. How did we first start mapping that immediate physical reaction when, a threat pops up? That takes us to the biology, right? Walter Cannon.
Right, the pioneering work of Walter Cannon and his famous fight-or-flight response.
Yeah.
Cannon was really the first to study the sympathetic nervous system's role in that acute stress response. It's the body rapidly preparing for a perceived threat. You get this immediate cascade of physiological changes.
Like heart pounding, breathing faster.
Exactly. Blood pressure, heart rate, respirations, cardiac output, they all shoot up. It's basically rapid preparation for either aggression or, getting away fast, withdrawal.
But his theory, while foundational, wasn't quite complete, was it? What did later researchers point out was missing?
Well, the main critique was that not everyone fights or flees. Cannon's model, though groundbreaking, was seen as a bit too simplistic because it didn't account for the freeze response.
Ah, the deer in the headlights phenomenon.
Precisely. That moment when the perceived threat is so overwhelming that you're just immobilized, that wasn't really in his original framework.
So that realization kind of paved the way for the next big name in stress research, Hans Selye.
Yes, Hans Selye, who expanded the view significantly with his general adaptation syndrome, or GAS. Selye defined stress a bit differently as a non-specific response of the body to any demand for change.
Non-specific. Okay, so how did his model work?
Selye gave us a three-stage model. It really shows the kind of life cycle of chronic stress. Stage 1 is the alarm stage. This is the initial brief adaptive response. Selye actually incorporated Cannon's immediate observations here, but he added a crucial second layer of defense.
So that first rapid layer is the sympathetic system firing up, the adrenaline rush.
Correct. The hypothalamus signals the adrenal glands. They pump epinephrine and adrenaline into the bloodstream. That's your classic spike. Increased heart rate, blood getting shunted to major muscles, senses sharpening.
And that's why you get dry mouth, right? Blood moves away from digestion.
Exactly. Non-essential functions get put on hold, but that adrenaline spike is short-lived.
So how does the body sustain that alertness if the threat continues?
That's the second component Selye identified within the alarm stage. The HPA axis gets activated.
The hypothalamic-pituitary-adrenal axis.
That's the one. This system produces cortisol. Think of cortisol as the long-acting stress hormone. Now, it is adaptive in the short term. It increases blood glucose for energy, boosts muscle endurance, but it also suppresses functions deemed non-essential for immediate survival. And that includes things like immune system activity and even memory consolidation.
Okay, so you're mobilized, you're alert,
Yeah.
but you can't stay in that state indefinitely, which leads us to stage 2.
Stage 2, resistance. Or you could call it the adaptation stage. Here, the body is actively trying to overcome the stressor to recover. But, and this is key, if the stressor persists, the body's forced to continuously draw on its valuable internal resources and defenses.
Like keeping the engine revving high all the time.
That's a good analogy. You're maintaining an active defense posture, and it takes a lot of energy.
And eventually, if those resources run out, stage 3.
Stage 3. Exhaustion. This is the real danger zone. This is the chronic state where resistance finally fails. Long-term, unabated exposure to cortisol starts to break down the system.
Leaving you vulnerable.
Exactly. Vulnerable to severe stress-related illnesses. We're talking things like anxiety disorders, major depressive disorder, certainly heart disease, chronic weight gain, digestive problems. The list goes on.
It's really important, though, that Selye also made a distinction, didn't he, between bad stress and good stress.
Yes, absolutely. Distress versus eustress.
Go.
Both place demands on the body. That's the key. But distress is that negative, draining kind of energy. Think financial overload, relationship crisis. It results in fatigue, anxiety.
Right.
Eustress, on the other hand, is positive energy. It actually motivates you. It leads to feelings of happiness, purposeful movement, like the thrill of taking on a challenging new job or even planning a vacation.
So the physiological response might be similar initially, but the outcome and feeling are totally different.
Yeah.
One constructive.
Precisely.
Okay, let's circle back to that mind-body connection. How exactly does chronic distress physically impact the immune system? You mentioned cortisol suppresses it.
Well, the link between the brain stress response, primarily that HPA axis we talked about, and the immune system is very direct. Chronic distress can literally slow down wound healing. Yeah, because the body's resources are being diverted elsewhere. And furthermore, research shows higher concentrations of cytokines. These are immune proteins that trigger inflammation in people suffering from major depressive disorder.
So stress causes inflammation.
It points to chronic stress creating a pro-inflammatory state in the body, which we know contributes to a whole range of physical diseases. It's not just in your head.
Fascinating. Okay, so we've got the biological machine mapped out. But obviously, stress hits everyone differently. Which brings us to the mediators, right? Those personal filters that can buffer or intensify the response.
Exactly. The stressors themselves can be pretty straightforward to categorize. Physiological ones like extreme heat, pain, infection.
Or psychological ones.
Right, divorce, job loss, but even positive changes like getting married or achieving a major success can be stressors.
True.
But the single greatest mediator isn't the event itself. It's the perception of that stressor.
And perception is colored by just about everything in our personal history and makeup, isn't it?
Absolutely everything. Factors like your age, gender, cultural background, your past life experiences, even just your general outlook on life, they all influence whether a particular demand feels, manageable or completely catastrophic.
Can you give an example?
Sure. Think about a minor traffic jam. For a carefree student with no deadlines, it's maybe a slight annoyance.
Right.
But for a new parent rushing to pick up their child from daycare before the late fee kicks in, That same traffic jam can feel like a full-blown emergency.
Yeah.
Same event, totally different subjective stress level.
Perception is everything. And beyond just our personal temperament, social structures play a huge mediating role too, right? Support system.
Oh, massively. They're almost non-negotiable buffers. Having strong social support systems is consistently correlated with better immune responses and even lower mortality rates.
That's powerful.
It is, and we also see interesting cultural differences in how stress is expressed. While Western cultures often frame stress in psychophysiological terms, anxiety, racing thought. In many Asian, African, and Central American cultures, distress is much more likely to be expressed in somatic terms. Physical complaints like headaches, stomach upset, fatigue.
That's a really important clinical point for assessment. And we shouldn't overlook the role of spiritual practices either.
Definitely not. Studies actually show that spirituality and religious practice can enhance immune system function and promote a greater sense of well-being. Even something as simple as prayer has been documented to elicit the relaxation response.
So it acts as both a physiological and an emotional mediator.
Correct. A powerful one for many people.
Okay, let's shift gears into practical application. If a clinician is trying to help someone manage stress, the first step is always assessment. What kind of tools do we have to sort of quantify both the objective events and that subjective feeling?
Right. We need tools to capture both sides of that coin. For the objective side, one common tool is the Recent Life Changes Questionnaire, the RLCQ. This is basically a revised version of an older scale. Specific life events are assigned a numerical value, a life change unit. For example, the death of a spouse might be assigned 119 units.
So you add up the scores for recent events.
Exactly. And generally, a score of 300 or more within a 6-month period, or maybe 500 over a year, is considered indicative of high stress due to accumulated life events.
But wait, just because someone scores high on the RLCQ, meaning they've had a lot of objective changes, doesn't mean they're falling apart, right? They might be handling it well.
Precisely. And that's where the second type of tool comes in, measuring the subjective experience.
Like the PSS-10.
Exactly. The perceived stress scale, often the 10-item version. This scale measures relative perception. It asks questions about how uncontrollable, unpredictable, and overloaded you feel your life is right now.
So it zeroes in on that subjective element.
It does. And that's crucial because, as we said, the perception is often more important in determining the health outcome than the actual number of events.
Makes sense. So once you've assessed, the nurse would typically look at strengthening the patient's core coping styles before just jumping to interventions.
Yeah, that's a key step. The source material highlights 4 main areas nurses assess and can target. Health-sustaining habits, things like diet, exercise, sleep, the basics, but vital. Then life satisfaction, looking at work, hobbies, sources of joy, humor. Third is the patient's existing social support network.
Right.
And finally, their current stress response mechanisms. What are they already doing effectively or ineffectively? These areas become the customizable targets for intervention.
Okay, let's open up that therapeutic toolbox then. The source material really emphasizes that mind-body therapies aren't just fluff. They're proven effective adjuncts for a whole range of conditions: anxiety, pain, even cardiac disease.
Absolutely. Let's start with one that uses technology: biofeedback.
Okay, how does that work?
Well, it involves using sensitive instrumentation, could be specialized sensors or even modern smartwatches these days, to give you immediate, real-time feedback on physiological processes. Things like heart rate variability, skin temperature, muscle tension.
Things you normally wouldn't be aware of.
Exactly. Things usually considered involuntary. The goal is simple. Use that immediate data feedback to learn how to gain voluntary, conscious control over those functions. Pretty cool, actually.
Yeah, it is. And then there's probably the most common technique used, at least in the U.S.
Deep breathing exercises.
Simple but effective.
Often overlooked because it is simple but incredibly powerful. Slow, deep, even breathing, really focusing on abdominal breathing, acts almost immediately to quiet that mental noise and interrupt the sympathetic nervous system's overdrive.
It's like a quick reset button you can press anytime.
It really is. A quick, self-administered fix.
Another technique that harnesses mental focus is guided imagery, right?
Yes. This is where you intentionally focus on pleasant, calming images. Maybe picturing a peaceful mountain stream, a warm beach, whatever works for you.
To push out the negative thoughts.
Essentially, yes. It actively diverts the brain away from negative or intrusive thoughts. It's shown to be really useful for reducing anxiety and also for managing pain. There are even studies showing its effectiveness with children undergoing surgery.
Wow. Okay, what about progressive relaxation? That one sounds interesting.
It's based on a very intuitive logic developed by Jacobson. The premise is straightforward. Since anxiety causes physical muscle tension.
Right, you get tight shoulders, clenched jaw.
Exactly. So if you actively train your muscles to relax, it should decrease the anxiety response itself. Patients systematically tense specific muscle groups, often starting at the feet and working their way up to the face, holding the tension tightly for maybe 8 seconds and then consciously fully releasing it.
Feeling the difference between tense and relaxed.
Precisely, building that awareness.
Now, two terms we often hear used interchangeably, but the source distinguishes them: meditation and mindfulness.
Yes, that's an important distinction. Meditation is really the broader discipline, kind of an umbrella term for various practices aimed at training the mind for calm and quieting that sympathetic nervous system activity.
Okay.
Mindfulness, while related and often involving meditation techniques, is more specific. It draws heavily from Buddhist traditions and focuses on activating what neuroscientists call the direct experience network of the brain.
Direct experience.
It means paying radical attention to the here and now. What are you actually seeing, feeling, hearing, tasting, smelling right now without judgment? Instead of living on that mental autopilot, worrying about the future or replaying the past.
Being present.
Being fully present.
And for integrating mindfulness into a stressful moment, the source offers a handy acronym, right? STOP.
Yes, STOP. It's an excellent grounding technique, easy to remember. S is for stop whatever you're doing.
Just pause.
Just pause. T is for take a breath. A conscious, mindful breath. O is for observe. Notice your thoughts, your feelings, the sensations in your body without getting swept away by them.
And P.
P is for proceed. Continue with whatever is important to you in that moment, but now with potentially more awareness and less reactivity. It just interrupts that automatic stress cycle.
Very practical.
Oh.
Another powerful skill, particularly highlighted in cognitive behavioral therapy approaches, is cognitive reframing.
Ah, yes, reframing. This is all about intentionally reassessing a stressful situation to identify and then replace irrational or catastrophizing beliefs.
Can you give an example?
Sure. Let's say a student fails a test. The automatic catastrophic thought might be, I failed, I'm an idiot, I'm definitely going to fail this course.
That downward spiral.
Exactly. Reframing involves challenging that, replacing it with something more rational and constructive, like, okay, I did poorly on this test, but if I identify where I went wrong and choose to study X hours for the next one, I significantly increase my chances of success. It's about shifting perspective to something more realistic and empowering.
And the source notes that humor can actually be a form of reframing.
It does. Humor is a powerful way to reframe because it instantly dissipates the intensity of a situation. By finding something comical, even absurd, in a stressful thought or event, you lessen its power over you.
Interesting. Okay, one last technique. What if a patient isn't even sure what is causing their strain? It just feels like this general sense of overwhelm. What simple tool does the source suggest?
Journaling. Just keeping an informal diary or log, even for just a few weeks.
How does that help?
It helps you start to identify patterns. You might notice, oh, every time I interact with this person, I feel drained, or after that specific meeting on Tuesdays, I always get a headache. It helps pinpoint those specific activities, interactions, or even times of day that trigger physical or emotional strain.
Makes the intangible stress feel a bit more tangible.
Exactly. Once you can see the pattern, you can start to address it.
Okay, that's a lot of ground covered. Can you maybe synthesize the key takeaways for us?
Sure. I think the main points are, first, stress is universal. It affects everyone. Second, Selye's general adaptation syndrome really illustrates the huge physiological cost of being in that prolonged, chronic state of arousal. That exhaustion stage is a real biological endpoint.
Right.
Third, successful management really depends heavily on identifying those key mediators, things like your support system, your cultural background, and crucially, your perception of the stressor. And finally, actively using evidence-based relaxation techniques like the breathing, the reframing, mindfulness is critical to interrupt that sympathetic overdrive before it leads down the path to physical illness.
That's a great summary. Which brings us to our final provocative thought for today, drawn straight from this material.
Okay.
We know chronic stress is a major player in illnesses like major depressive disorder, and our sources explicitly state that physical activity like getting 150 minutes of moderate aerobic exercise a week significantly cuts the risk of depression, even for people with a high genetic vulnerability.
Right. Exercise is powerful medicine.
So given that we know physical activity directly modulates the HPA axis, that stress gas pedal we talked about, here's the question for you, the listener, to ponder. What type of stress reduction technique might be most immediately suitable, most appealing, for a patient who carries that genetic vulnerability to depression, but also highly values a sense of physical control and achievement?
That's a good one. Something to really mull over as you integrate this deep dive into your own clinical thinking and practice. Yeah.
Absolutely. Lots to think about there. Thanks for joining us for this deep dive.
Thank you.
Until next time.